A new report has found that delaying mental health care for teens isn't just detrimental to the patient, it can be costly for the healthcare system as a whole. Researchers with the Conference Board of Canada, in their report, Nurturing Minds for Secure Futures, found that long delays in getting mental health care for youth costs an estimated $4 billion. Through the report's modeling, they found that managing anxiety and depression in youth could cost Canada more than $3 billion in publicly funded systems. It found if Canada invested in mental health care services and support, costs would decrease from $4 billion to $1.5 billion a year and help more than 1.5 million youth in Canada who suffer from depression and anxiety. Joining now from Ottawa is Emily Gruenwoldt, the President and CEO of the Children's Healthcare Canada. Emily, thank you very much for joining us this morning.
Good morning.
Well, there are some staggering numbers out there, high rates of anxiety and depression for youth. How is the system currently set up to help them?
Well, what we're seeing from coast to coast is many children and youth are waiting too long for the essential healthcare services they require. This report really puts a spotlight on mental health services in particular and measuring not only the cost to our healthcare system for these prolonged waits for care, but also the measurable costs that our families are experiencing, out-of-pocket costs, as well as the human costs for the children and youth who are waiting for services.
Now, the system, as you say, there are delays, it takes a long time to get help. What are the key improvements? What needs to be done right away that can make a difference?
We're looking for cross-sectoral investments, a really coordinated approach between federal governments and provincial governments, but also looking at all the different providers of service who are supporting children and youth. And as the report outlines, these service providers find themselves not only in our healthcare system, but also in our education system, within social services, and also within justice. So a coordinated approach with new investments is really what's going to help us move the needle on the wait times for children and youth who are looking for mental health services and supports.
Do we have the personnel, or do we need to start getting them out of schools and getting in to help people? Is there enough staff to help these kids?
Yeah, that's a great question. And I think a challenge we're experiencing in our healthcare workforce across the board. So absolutely, we're seeing challenges insofar as a growing demand from children and youth seeking services and a shrinking pool of resources in our healthcare workforce with specialized services to support children and youth. The structure of our system, the very siloed approach to how we deliver these services, both in the private sector, in the public sector, really creates different incentives and also creates lots of barriers for children and youth without the means to access services in the private system. So there are challenges in both sectors, in both spheres. And so we do need to start thinking long term about how we're training the next generation of highly specialized mental health service providers.
And it really is important to get these kids the help quickly, because the quicker you can get to them, the quicker they can recover, right?
Absolutely. We know that over 70% of mental health disorders have roots in childhood. And so the early intervention aspect of this report is really important. It really goes to show that early investments to ensure that children and youth have access to timely assessments, diagnosis, as well as therapies pays lifelong dividends to their health and well-being. And again, of course, in terms of the cost to our healthcare system directly.
And it's a frightening thing. I mean, it's still growing. We talked about maybe in the pandemic, that was stressful for young kids especially, but it's still continuing. Is it the pandemic, like a fallout from the pandemic, or is there more to it?
I think it's a confluence of factors. There's no question that the pandemic really shed undue stress on children and youth who were suffering with some of the protective mechanisms we have in place to protect against the spread transmission of COVID-19. We saw a spike or a surge in visits to children's hospital emergency departments specifically related to children's mental health. But those visits are continuing, and there are continued circumstances within our environments and within their own personal health that's creating a longer term challenge for us and helping us to understand that this is a problem we need to solve today, but also for tomorrow.
Emily, thank you very much for sharing your insight today.
You're welcome.